So knowing when psychotherapy is needed involves recognizing certain signs and symptoms that indicate you might benefit from professional mental health support. Here are some key indicators that suggest psychotherapy might be beneficial for you. First, you're experiencing persistent or intense emotional distress. If you're experiencing overwhelming feelings of sadness, anxiety, anger, hopelessness, and they persist over time and don't seem to be getting better with self-help strategies or with support from your friends and family, it might be time to seek out a therapist. Similarly, if your emotional distress is getting in the way of daily functioning, such as work, school, or relationships, it also might be time to seek out a therapist. The second would be behavioral changes. If you are noticing changes in behavior, such as withdrawing or isolating from social activities, avoiding responsibilities, engaging in risky or self-destructive behavior, it might be time to seek out a therapist. Similarly, if you're having difficulty in managing daily tasks and maintaining routines, and like engaging in poor self-care or neglecting important obligations, it might be time to seek out a counselor. The third thing is physical symptoms. Physical complaints that have no apparent or medical cause, such as unexplained aches or digestive problems, frequent headaches, they might be linked to psychological distress. Similarly, sleep disturbance, such as insomnia, excessive sleeping, or nightmares, might indicate you could use the help of a mental health counselor. The fourth thing is relationship issues. If you have persistent conflicts or difficulties in relationships with family, friends, or partners, it might be time to reach out for extra help. The fifth thing is trauma and grief. If you've got difficulty in coping with a traumatic event, such as an accident, a natural disaster, abuse, or a significant loss, a counselor could be helpful for you. This is particularly true if you have prolonged or intense grief that impairs with your ability to function daily. Another thing is if you have changes in appetite or weight. Significant changes in your eating habits, such as overeating or undereating, which might lead to noticeable weight gain or loss, might indicate you could benefit from talking with a counselor. Similarly, substance abuse. If you're increasingly relying on alcohol, drugs, or other substances to cope with daily life or with your emotions, it might be time to reach out for help. This is particularly true if your substance use is interfering with your daily life and your ability to care for yourself. Chronic stress is the eighth reason that you might want to seek out psychotherapy. This is feeling constantly stressed, overwhelmed, unable to relax, even in situations that were previously manageable. Now might be the time to reach out for a counselor. The ninth thing is self-harm or suicidal thoughts. Engaging in self-harm behaviors and having thoughts of suicide or self-harm are definitely indicators to reach out for a psychotherapist. Expressing feelings of worthlessness or believing that life is not worth living are also indicators that it's time to reach out for help. Finally, if you're having difficulty adjusting to a major change in your life, like a life transition, such as a new job, relocation, retirement, or a significant change in your personal circumstances, a counselor could be very helpful to you. So these are many of the reasons, or some of the reasons, that you could be reaching out for support